What is leukemia? Leukemia makes 35% of cancer cases in childhood, ranking first. Leukemia is divided into two main groups according to cell type: ALL, acute lymphoblastic leukemia, and AML, acute myeloblastic leukemia. Subgroups can be defined within themselves. 1,200 to 1,500 new children cases with leukemia under 16 years old are reported in Turkey each year. Causes of leukemia have not been enlightened completely yet. It has been shown in studies with new developments in cytogenetic and molecular techniques that leukemia is caused by genetic tendencies, radiation, benzene, and its derivatives, such as glue, chemical substances such as insecticides, some inherited diseases, and some viral diseases all together. Leukemia is now seen at all ages. It increases most frequently around 2 to 5 years of age during childhood. Response to the treatment decreases in cases below 1 year old and above 10 years old. An increase in blood cells, called blasts, which are immature cells, occur with the change of cipher in stem cells in our bone marrow, which is the main production site of blood circulation in our vessels due to any influence. These cells spread rapidly and occupy bone marrow, lymphatic glands, spleen, liver, brain, and the central nervous system. Symptoms. The first appearing symptoms of leukemia in children are anorexia, the loss of appetite; anemia, weight loss; bone aches on legs; subcutaneous hemorrhage, which is basically red spots or bruises; nose and gingival bleedings; and fever. Moreover, symptoms related to involved organs, such as headache, vomiting, abdominal pain, visual disturbances, may be important too. On the examination by pediatric hematologists of blood diseases applied with these complaints, mostly liver and spleen enlargements, hepatosplenomegaly, enlargement of lymphatic glands, and symptoms of bleeding can be determined. Definite diagnosis can be made as a result of blood, bone marrow, cell typing, and genetic analyses. Detailed tests for diagnosis will generally be helpful for determining the type and treatment principles of the leukemia. Treatment. Treatment primarily starts with methods of correcting the general status. At this stage, giving blood or specific cells in the blood from donors, basically volunteer blood donors, to a leukemic patient, making the required interventions if there is an infection, taking precautions for protecting the kidneys, liver, and heart from any side effects of chemotherapeutic drugs are very important. Also, informing patients and their families about the disease, explaining that leukemia isn't an hopeless disease, but improvement can be obtained with ratios reaching up to 85% with a good treatment and moral support is the second stage of the treatment. First, treatment principles. It consists of administering at least 6 different drugs within 4 to 6 weeks via an intravenous and oral route. The aim is to eliminate malignant stem cells called blasts. But unfortunately, these chemotherapeutic drugs not only affect malignant cells, but also destroy beneficial cells of our body. For this reason, hairs of children fall, wounds occur at their mouths and intestines, and they become weak. Therefore, leukemic children wear a mask for protecting themselves from getting microbes from people around, air, and water. LÖSEV. LÖSEV is a non-profit NGO mainly aiming to provide educational and emotional support, financial assistance, and other health services for children who have leukemia or chronic blood disorders in order to help them cope with a life-threatening illness. Other goals are to promote knowledge and provide instruction on an international level regarding acquired and inherited blood diseases, as well as establish and operate research institutions. Every year in Turkey, we see around 1,200 to 1,500 new cases of children diagnosed with leukemia. Families with limited financial resources may be forced to make a difficult decision, that of choosing to support their healthy child or their child who has leukemia. LÖSEV is here to help shoulder this unexpected financial burden. However, not only does it aim to provide income for these little heroes, but it also endeavors to communicate the problems of our children and their families to our society in order to create awareness of leukemia.